Welcome, everybody. All right, today we're talking about somatic pain. It's all about in your head. One of the most distinctive forms of psychology today is none other than somatic psychology, relying on the knowledge that the mind and the body are interconnected. And it's really important to understand that there is a call of the body. Your body can store trauma. And this was a radical claim way back, which came from Wilhelm Reich, which was a student of Sigmund Freud. And he proposed that back in 1933, that trauma stretches beyond your mind and could lead to inflammation, pain, muscular tension, and other reactions within the body. And repressed thoughts and emotions might be the problem behind seemingly psychological, physiological rooted symptoms. Reich also believed that the symptoms are the body armor that would defend us against traumatic experiences. And these breakthroughs led to a new way of approaching mental and physical issues, embracing the connection between the mind and the body. And that, once again, is called somatic psychology. And somatic psychology is a form of body-oriented therapy that uses techniques and holistic approaches to help alleviate a patient's mental and physical issues. Here is the interesting thing about science and human life. The most effective medicine on the entire market, 6 times better than any other medication out on the market, is the placebo. The placebo is the most effective medication on the market that we have to offer in the human race. And so, if we think about it, we as people come to conclusions in our mind as to what our health issues are. And we are such delusional creatures that we tend to buy our own ideas of what's right or wrong about us. That we feel we intuitively understand our bodies. And the problem is that since we cannot see many of the physical ailments that we have, we make it up in our brain and fill in the gaps. And when we do that, we live as if that is the truth. And that creates what are called somatic symptoms. Many people, surprisingly, can have an argument with their spouse and suddenly they go into a migraine headache. Or they could have a party where they enjoyed a good time and suddenly, under the same conditions, without the argument, they can be just fine. Our mind and our bodies are tied together, and we as people have to understand how that works. So, in the field of somatic therapy, there's a lot of integrated approaches operating with both physical and talk therapy. And this is there to help clients develop an awareness of their repressed thoughts and emotions and regulate the stress levels and move past traumatic experiences. So the truth is that to get to a traumatic experience and to alleviate a traumatic experience, we have to turn it into an event rather than a lifetime story. There's a lot of people that will go through a traumatic event like, let's say, domestic violence or rape or being robbed in public, or having yourself beaten up, or going through a car accident, whatever these things might be. And we let, because those events make such a strong impression on our brain, we will let those events dictate who we are. And we will filter our security in life, our self-esteem in life, our ability to relate to people in life based on these traumatic events. And we will seed them into our brain as a part of our individuality. If you want to heal from trauma, you have to learn to disassociate and break away from the trauma and call it an event rather than your individuality. There are various somatic approaches or frameworks for looking at therapy. There's sensomotor therapy, there's biodynamic therapy, there's bioengineering, analysis, and the most common one is somatic experiencing. You know, there's a thing called systematic desensitization. So let's say you're afraid of riding in an airplane. So you may make a reservation and cancel it. You may go to the airport and sit outside but not get on the plane. And then you may eventually decide to get on the plane. But when you get on the plane, you sit in a seat that you have more room and you don't look out the window. And then eventually you sit on a plane and you travel somewhere and you do look out the window. And that's called systematic desensitization, where you break it down piece by piece by piece and you gradually diminish the arousal associated with the trauma by increasingly tolerating and accepting the physical sensations that come with moving into the experience in a safe way. Another framework that has similarities to systematic or somatic experiences is also crucial differences used by somatic therapists. It's sensomotor therapy. And during the sensomotor therapy sessions, clients are taught to distinguish between trauma-based emotions and physical sensations by cultivating awareness of their differences. Being aware of your differences facilitates the processing of unassimilated sensomotor reactions to trauma. Now, that's a lot of psychobabble, but here's the deal. So let's say you have a traumatic experience around, let's say you pass by a place where you had an auto accident, or let's say a place where you were robbed, and all of a sudden you have a great avoidance for that place. So the next time you go to that place, you come with the traumatic feelings involved in going to that space. Can you separate the trauma feelings and the fear associated with going to that space with just going to that space as it is? Because it wasn't the space that caused the traumatic experiences as much as it was the circumstance. And if you can circumstantially understand each piece of your traumas, you will divide yourself from the place where the trauma happened and subtract the sensomotor experiences that you have because of the trauma. If you can detach those experiences and understand those belong to the trauma, they don't belong to the space, you can now start to heal yourself. This bio energetic analysis is another type of framework. It involves assessing and intervening in the emotional realm through bodily movement experiences. You know, the underlying assumption is that significant life experiences are not preserved in the mind, but also in the body's language, movement, and breathing. And this is because mental, emotional, and physical processes are combined, are integrated. You know, and for a long while, most people assume that psychological issues start and end with the mind. However, the field of somatic psychology, which began with the insights of great thinkers like Wilhelm Reich, Pierre Janet, showed that there might be a deeper connection between the problems of the mind and the body that we previously imagined. Well, what runs the show in your body? What runs the show is your brain. Your brain will be the last organ that is preserved because your brain runs everything else. So let's say when your body starves itself of oxygen, it's because you hold your breath, or you can't breathe through your nose, or you're not breathing through your mouth or your nose. What's going to happen is your brain is going to preserve all the oxygen. Well, oxygen is what makes the sun blow up. So that's how your organs churn blood through them. They can't churn blood without oxygen. But if the brain steals all the oxygen because it carries 33% of the blood supply, there's a good chance that all your organs are going to start to shut down when you're not breathing. And so what you have to understand is the brain is selfish. It has to run everything else. So it's going to take everything it needs to keep itself alive, and the rest of your body is going to sputter. So your brain and your body go together. Your circulation, it all goes together. Your body tries to protect you and stores pain and emotional damage caused by traumatic experiences so that you will be reminded of those experiences and you will save yourself. It tends to help you heal the damage also. It calls you through various somatic symptoms like inflammation, muscle tension, fatigue, and others. You know, your body takes cues from your brain. And practitioners of somatic therapy act as guides that help you hear the body's call. They teach you how to strengthen your mind body connection and find the resources from within that lead to the healing of yourself. So, for instance, if you're a person that starves your brain of oxygen because you hold your breath all the time, you try to breathe through your nose, you only breathe through one nostril at a time. That's why you get boogers on one side because you have one wet side, one dry side, and every 4 hours it flips back and forth. So if you're not a mouth breather and you're a nose breather, you're probably getting a straw's worth of oxygen. So if you want to get more oxygen and make your body supplement itself and be healthier, you want to drink water because water has about 86% oxygen. So if you want your organs to operate at full capacity, drinking water throughout the day, especially from an aerated bottle, a sports bottle, is the best possible thing you can do because in a sports bottle, it breaks out the oxygen immediately. So your body doesn't have to break out the oxygen. It's already done for it. You know, it's really interesting that somatic symptom disorder involves focusing too much on physical symptoms like pain or tiredness. And this focus causes major emotional distress and makes it hard to function. Number one, it makes it hard to breathe because your breathing becomes very shallow when you start to go into fear. You may or may not have another medical condition that causes these symptoms, but how you think, feel, behave because of the symptoms can be extreme. You might often think the worst about your symptoms. You seek medical care all the time. You're probably a hypochondriac because every time some little thing comes up, you're going to blow up and have to go to the doctor. I've got to get confirmation that I'm not dying. You know, so many people get all caught up in their symptoms. They're so hyper aware of their symptoms that they don't ever calm down. You know, some people are so afraid of death and so afraid of pain, they spend their whole life avoiding it. Other people take pain as a part of life and you just deal with it. And not everything's going to kill you. Sometimes you just have to move through pain, or sometimes you have to back off a certain part of your body so it can heal. But people that have somatic symptoms, they oftentimes exacerbate those symptoms based on their levels of anxiety. And then their body starts to shut down at the same time. While their brain is eroding in fear, their body begins to erode because their breathing is horrendous. Pain and shortness of breath, these are specific system problems that happen with somatic disorders. Somatic disorders are thought-based. So pain is only relevant when the brain makes it relevant. So if your brain is going to make pain the most important part of what's going on, that's going to cause you a lot of somatic symptoms. For instance, when you're a baby, you may have fallen down, but you probably didn't start crying until you saw the reaction of somebody going, "Oh, are you okay? Is everything all right? Oh, you poor thing." And all of a sudden, the baby will start crying like crazy and feeling pain. Why? Because of the way you're responding, they feel like that's what they have to do. So many times we take pain cues not only from our brain, but from how we choose to react to pain. So pain can become intense when you react to pain. Shortness of breath also happens because many people live with anxiety, which is called fear. If you're going to live in fear, you're going to hypothesize 8,000 different outcomes for every single situation, which causes your brain to have to work like a dog all day, every day through life. How overwhelming is that? Living in fear when what we're built to do is live in faith. Faith is how we live. Faith is very simple. I have faith when I go to the grocery store that the crack addict's not going to kill me. I have faith when I get in my car, I'm going to get to the destination. I have faith that I'll be able to handle myself if something bad happens. I have faith that things are going to go okay when I go to work. You know, we have to live in faith. That's how we move forward. If you have no confidence in yourself, you're going to predict all the worst symptoms. And guess what? Your brain is going to allow things to come forward to get in your way, which includes medical issues. Feeling tired and weak is also oftentimes a somatic problem. Tired and weak has to do a lot not only with illness like a flu, but it also has to do with your brain because you become weak because of your attitude, because of the way you allow things get in the way of your life. So people with anxiety allow enormous amounts of things to get in their way. These people are horribly employed because every time they feel some weird crap, they're going to give less to their work or not give the work at anything at all. And so people that are hypersensitive and anxious and depressed and submit themselves to anxiety and depression as a way of life often have somatic symptoms. Oh, I've got my migraine today. Oh, I'm not feeling very well. Oh, I didn't sleep very well, so I'm not going to be able to do what I did yesterday. These people go through life based on how they're experiencing their life is going to give them how much they're going to give to their job, to their life, to their children, to their marriage. People that are depressed and anxious, if you dropped them in the middle of a third world country into a jungle, they'd all be dead. Dead, dead, dead in about 2 weeks because you can't afford to be depressed and anxious when you live in a third world country because you have to survive. However, people that are nice and cozy and safe can afford to have somatic symptoms because they spend all their time thinking about their pain, thinking about their, oh, I can't accomplish this, hypothesizing every possible outcome instead of just being resilient and surviving and being cautious in a way that, you prevent things from happening to the best of your ability. But if it happens, you're going to do the best you can. There are also symptoms that are not related to medical causes. Symptoms related to medical conditions, but they are more severe than usually expected. One symptom, many symptoms, are symptoms that change over time. Mild, moderate, and severe symptoms. A lot of those are exacerbated by your attitude. Am I going to let this pain run my life? Am I going to let this migraine run my life? All right, we're going to take a quick break and then we're going to come right back. Welcome back, everybody. All right, we're talking about somatic symptoms and how it is all in your head. Pain is the most common symptom, but whatever your symptoms, you have constant stressful thoughts, feelings, behaviors related to those symptoms. We develop fears. Then we start Googling and AIing all of our, chat GPT or Grok or whatever you use to try to figure out what our symptoms are, what's going on. And all of that is to get it more information. But oftentimes, what that does is exacerbate your worries. And worries create fear. And fear is the main ingredient that somatic symptoms operate by. People with somatic symptoms often constantly worry about possible illness or much of the symptoms that affect them. View usual physical sensations like a sign of severe illness. They fear that symptoms are serious, even when the illness has been ruled out. They feel like, oh, you don't know. I don't know. I think I really have this problem. They believe that their intuition and their knowledge of their body is going to always give them the answer. They don't trust people. They don't trust doctors. They don't trust a lot of things. They second guess everybody. And in this environment, in this world that we're in now, that we have all these wokey wokey doctors and wokey wokey nurses and wokey wokey crazies, and now that all of our medical schools are wokey wokey, there is a lot of crap out there. So yes, that gives even more reason for somatic symptoms to come forward because you don't know if the opinion you're getting is educated enough to give you an opinion. And then there's trauma and post-trauma. What comes with that? Well, stress, anxiety, uh, dysphoria, disorganization. Also, addiction sometimes comes. Also, grief, sexual functions oftentimes fail. Somatic therapy is used to the treatment of some of these physical symptoms because what it's meant to do is to learn to separate the somatic symptoms from the real symptoms of what you would go through if you had the disorder that you're convinced you have or the illness that you think you have. Oftentimes people that have somatic symptoms go through chiropractic, chronic pain, digestive disorders, chiropractic back pains, sexual dysfunction. So what you have to expect, the sessions, if you're going to treat it very widely among people that treat this. But it usually combines mindfulness, talk therapy, and what could be considered alternative forms of physical therapy. So the therapist helps you focus on your body, revive your memories of the traumatic experiences, pays attention to the physical responses, and once the emotion is experienced or the memory is recovered, how to currently put it into perspective and align it to the event rather than your current life. It's really important to understand that physical awareness is a key part of somatic therapy, but not catastrophizing your bodily experiences. What you have to understand is that how I think also affects how I'm approaching being ill. How I think has to do with everything about how I recover from surgery. How I think develops how I will heal from having my knee replaced, for instance. We have to understand that our brain runs a show and we have to give it a part of the healing process. We can't just let our body heal. Our mind has to heal also. That is a very important part of healing from somatic symptoms. What somatic therapy does is it looks at the connection of the mind and the body. It uses both psychotherapy and physical therapies for holistic healing. So the mind body exercises means that, like in yoga or in meditation, where you become very familiar with how bodily movements affect and how your mind is connected to those bodily movements, how your brain receives pain receptors, and then you are able to figure out how much power do I want to give this. People that are convinced that they are physically fragile and medically fragile spend their whole life examining their body all the time. It occupies so much of their mental space that any little twitch in their physical experiences is going to make them get hyperactive and hypoactive around, and their brain activity is going to be centered around their physical symptoms. Somatic therapy addresses what they need to split between the body and the mind. Though it's not always apparent, thought, emotions, and sensations are all interconnected and influence each other. You have to treat the whole picture. So if I'm going to heal from a surgery, I better figure out what is going to be my attitude when I'm healing. That is a huge part of healing. What is your attitude towards the healing? It's very important to understand that things like meditation and yoga are very somatically helpful because they incorporate guided treatments and guided understandings of how your body and your mind are connected. Somatics is a broad term. It's focused on body movements as a means to improve mental health. And its history dates back to physical education movements of the 19th century, and it's included in a whole lot of things like yoga, Pilates, and judo. Among the most prominent schools of somatics is created by Thomas Hanna, who in the 70s introduced and named the concept of somatics. He theorized that for sufferers of chronic pain, a significant amount is a result of sensory motor amnesia, in which neurons in the brain have lost their ability to properly control muscle tissue. And he believed that through education, mindfulness, vigorous, and intentional movements akin to physical therapy, a patient can reinvigorate their mind and body pathways and relieve chronic pain. It's interesting because I remember going through physical therapy and I was having a problem with my knee, and they put this little bump thing in my shoe underneath down by my heel. And basically, that little bump in my shoe alleviated the pain because it helped the way that I was walking. It supported the way that I was walking because I'm flat footed. And so, what I'm trying to say is, many times there are very physical ways that you can alleviate pain in your body. There's also mental ways that you can alleviate pain in your body. You don't have to go into just medication. There's also this thing called the Hikomi method, and it was Ron Kurtz developed this back in the 70s, and it emphasized the physical nature of how we live in our bodies, relies on the deep and sustained mindfulness. It may not involve any body work, but as the therapist guides the patient's attention to their bodies verbally. Nonviolence is a guiding principle for that method. So what that means is you go through and you scan your body and you figure out what kind of sensations are associated with each part of your body. And by doing that, you can learn to self-regulate. Pat Ogden back in the 80s and the 90s helped create the field of sensory motor therapy, drawing fundamentals of the Hakomi method. Sensory motor therapy incorporates ideas from cognitive behavioral and neuroscience. There are many more types of ways to go about the therapies, but it's really important to understand that we need to come to grips with somatic disorders. You know, we tend to believe that any time that we have a physical sensation, especially people that are highly sensitive to how their body feels at any given time, they believe they need more physical evaluation and treatment. But here's the deal. At least 60% of what a doctor is going to treat has somatic components to it. That means it's the way you're thinking about the problem that is exacerbating the problem. So many times a doctor can treat, let's say, the flu or a cold or, whatever, gout or whatever issues a human being has. But the bottom line is, yes, that can be treated, but your thought processes around what you have also can exacerbate how you feel. This is a very important part of life, is you have to come to grips with how your brain is assessing any medical problem. If you sit around believing that you have cancer because you have a lump on your breast and you are sitting around waiting on the time that they're going to take a sample and figure out if you have cancer or not, but you're convinced yourself that you're going to have cancer, suddenly you're going to feel a whole lot of other physical symptoms, and you're going to convince yourself that you have cancer, and you're going to prepare yourself for that diagnosis, and then suddenly when you go to the doctor, you're going to be prepared for this horrible diagnosis. Well, that's not the way it all works, guys. You have to have a little faith that yes, you may discover things. You may have a lump somewhere you're not supposed to have a lump. Yes, there's probably a medical issue around it, but it doesn't mean it's the worst possible outcome, and it doesn't mean your brain has to go to that worst possible outcome and treat you as if you have that problem. Fear that physical activity may cause damage to your bodies is a big deal. Physical activity does cause damage many times If you don't exercise properly, I can't tell you how I ride a bike every morning. So when you ride a bike every morning, it's Peloton, believe me, it's not out in the rain or anything like that. But if I put the seat at the wrong angle, there is a good possibility that my back is going to hurt after I ride because I may bend over in the wrong way if I don't put the seat in the right location. What does that mean? Oh my God, my back feels weak. Oh, does that mean I have cancer? Does that mean I need to go to the doctor? No, it means I need to adjust the seat. We need to pay attention to our body in a way that we don't go to the worst possible outcome, but we go to what can I do to alleviate that pain because that pain might be coming from the fact that I'm not holding my posture very well. There's a lot of the things that we go through that we go to the doctor over that we have complete control of if we just think about how am I thinking about this problem? How am I treating my body when I'm riding my bike or when I'm exercising, when I'm working out? How am I treating my body? Because that oftentimes is what is causing the pain. Your brain dictates that, and we have to come to grips with that as people. But when do you want to see a doctor? Because physical symptoms can be related to a medical condition. And it's not a bad idea to assume it's a medical condition. That's a great thing. Assume it's a medical condition if it's especially something chronic and go to the doctor. It's important to have a professional look at you, but it doesn't mean you're always going to have a medical issue that needs to be treated by medication. It may be an issue you need to go to therapy. I can't tell you how many times a doctor has sent someone as a referral to go to therapy because the way they're thinking about their pain is causing more pain. The way they're thinking about their flu is causing worse symptoms in their flu. The way they're treating their cold is causing them to have a worse cold. After a medical exam, if your healthcare professional believes that you may have somatic symptom disorder, you can talk about a referral to a mental health professional who can work with you and your healthcare team. But a mental health professional can help you understand your condition and learn how to lessen your symptoms to make your quality of life better. Because how you think about it plays a big role in how you experience it. Now, when it's somebody else that has a somatic symptom disorder, it can be hard to accept that a serious illness isn't the cause and that the person can still function in life despite the symptoms. So you want to encourage the person to follow through on a mental health referral. But the deal is, if you're living with somebody who's a hypochondriac, if you're living with somebody that takes supplements and then they start taking more supplements and more supplements and more supplements and they can't go off any of these supplements because they all do something incredible for me, called a placebo. The deal is that that person has a mental problem. They have a mental problem because they are exacerbating their symptoms. They feel that their life is fragile. They feel that their life is limited. They're looking at their life through a lens of fear rather than faith. And so, since they're going to live in fear, they're going to hover in the cave and they're going to limit every option to every choice they ever make. Are we going to go on vacation? No, I can't go on vacation because I'm probably going to feel this way and this is going to happen. And I just can't pack enough of my supplements to get me there. No, no, no. They have 1,000 reasons not to do anything. People that are hypochondriacs, people that are somatic, are people who worry. They spend all their time in their brain hypothesizing fear and then buying their own hypothesis. Then there's genetics and biology, which also causes a higher sensitivity to pain. So for instance, if your family or your mother or your father had cancer, I surely have cancer. If your parents had Alzheimer's disease or dementia, I'm probably going to get that. I better look for the signs when I'm 40 years old. People will live as if they're going to get what their parents had or what's run in their family. Yes, we do have genetic problems. Yes, we do have genetic symptomology. Yes, we oftentimes have heart disease that runs in our family, and many of us die of heart attacks. But the more you're aware of it, the more you can prevent. Preventative medicine is much more effective than medicine that's going to take place right away. You want to live a life that prevents your genetic disorders. You know, That gives you an edge. That's what you want to do is get ahead of your genetics. But people that don't and then just sit around in denial that that's never going to happen to me, well, that's fine. It may never happen to you, but when it does, it's going to be a traumatic experience and it's going to affect the way you think about your health and the way that you treat your health. It's very, very important for us to be proactive with our health rather than reactive. That means get your ass out of bed and go work out and stop checking in with your feelings about working out and go do it and then check in with your feelings. Go and eat in portions. Eat moderately. Check your how am I full? You know, you may be halfway through your plate. Am I full? If I'm full, then I'm full. Stop eating. Take the rest home. Put it in the fridge. If you can't get rid of your food, if you have to clean your plate, you're crazy because you're not checking in with when you're full. People that have to clean their plate oftentimes are, as big as a skyscraper. So if you want to be fat and you want to be out of shape, have to clean your plate. If you want to be wise, check in with your stomach. Let it settle. Let it eat the food. Eat slowly so that your digestion can dictate to you how much food you can take in. Past trauma like sexual abuse and childhood trauma, many people have weight problems because they don't want their body to be seen sexually. That's how children protect themselves from sexual trauma in childhood is they get fat so that adults or other predators won't look at their body sexually. But you want to move through that trauma and heal. We have to come to grips with our bodies. And many people, especially in the United States, have horrible diets, take horrible care of themselves. As a matter of fact, when you go on vacation anywhere in the world, you can always spot the Americans because they're like big old cows walking the streets. So we have to come to grips that we are a very unhealthy culture, an unhealthy country, and we need to come to grips with that. All right, we're going to take a break. We're going to come right back and talk more about somatic symptoms. So come back. Welcome back, everybody. We're talking about somatic symptoms and how they affect your life. That's how your brain and your body work together. People that have somatic symptoms have oftentimes have other complications. Somatic symptoms usually follow people that have poor health. People that have poor health, which I call a suicidal life, if you don't take care of your body, you're living a suicidal life. You want to die, you just don't want to know when you're going to die. There are so many people that live a suicidal life. They drink, they smoke, they take drugs, they don't take care of themselves, they get fat. They want to die. They just don't know when. They don't have the courage to know when to die. But the deal is they don't value their life. They just want to escape it. And there's a lot of people like that. A lot of people have trouble functioning in daily life, including having a physical disability. Many people have trouble in relationships. Especially after COVID. I mean, even before COVID, but people can't even talk to each other anymore. People can't even carry on a conversation. People can show very little interest or empathy. I mean, we live in an assassination culture where rather kill you than have a relationship with you, especially if you vote for one or the other. Other mental health conditions like anxiety and depression, increased suicidal risk is related to depression, but it's also related to somatic symptoms. But anxiety and depression play a huge role in how much somatic problems you're going to have, how much your brain is going to exacerbate every poor health signal that your body sends. Having a hard time processing emotions or feelings leads to a lot of physical symptoms. Many people repress their emotions. Many people live a very fragile life. Many people live in a lot of insecurity. And if you feel like your life is going nowhere, you have very little value, it is going to affect how you take care of yourself. It's going to affect your resiliency when hard things happen to your body. Gaining attention from illness is another thing that causes somatic symptoms. Kids learn very early on that if I have a cold, I may not have to go to school for the whole week, especially if I have a lazy parent. So if I have a lazy parent, there's a real good chance if I get a cold, they'll just tell me to stay home. And then guess what? They have an excuse to not go to work too. I have PTO days. I have sick days. I'll just take all those days because I have a sick kid. So people take great advantage of sickness. People take great advantage of the feeling of illness, and they will use their brain to exacerbate their illness to gain the greatest advantages they possibly can. Avoiding activities due to pain, which worsens the level of a disability. It's a learned behavior. If you feel a certain amount of pain, I just can't. I just can't do that. I can't. I can't. I can't walk up those stairs. I can't do that. You can. You can do a whole lot more than you think you can. That's the problem, is we limit ourselves because we get an idea in our head or a learned behavior in our head. This is the way I deal with this problem. Somatic symptom disorder includes having anxiety and depression, a medical condition, recovering from one, the risk of developing a medical condition, which is a bigger part of somatic symptoms, and if you have a strong family of illness, there's a real good chance you're going to have a lot of somatic pain in your life because you learned from the best. Stressful like events, trauma, violence, that can also cause somatic symptoms. There's many people that repress their emotions, that don't allow themselves to express their emotions, but then they walk around with migraines, they walk around with pain, they walk around with all kinds of bodily symptoms because their body is going to express what their brain doesn't allow them to express. So it's going to find ways to do it in your body. So your body is going to be a wreck while you're sitting around not expressing your emotions. And that happens. And yet many people, especially guys that are stubborn, they're going to even suck in the pain that their body is experiencing. But it's really understanding how our mind and our body are tied together is a big, big deal. Money concerns happens due to a lot of healthcare visits. This is a big problem with people with somatic symptoms. They love to go to the doctor. And yes, copays add up, especially at the first of the year when your plan starts all over. Little is known about how to prevent somatic symptom disorder, but here's some suggestions that might help you. First of all, get professional help for anxiety and depression because that comes with somatic symptoms. Get the treatment. Learn how to identify stress and how it affects your body. You want to practice stress management, relaxation techniques. You also want to choose healthy routines like sleep habits, regular physical activity, social activities. Keep your life in balance. Don't attach your identity to only one thing, like how I'm a parent, what my job, my marriage, going to church, whatever, being an athlete, going in, being in a sport. Don't attach your identity to just one thing. You also want to get treatment early if you think you have somatic symptom disorder. Follow your treatment plan to help keep the symptoms from getting worse. But you want to go to somebody who's experienced in treating somatic symptoms in a mental health capacity. That is a very important thing. Also, your somatic nervous system is a very real thing, and it's a subdivision of your peripheral nervous system, which is all of your nervous system except your brain and your spinal cord. Your somatic nervous system allows you to move and control muscles throughout your body. It also feeds information from four of your senses: smell, sound, taste, and touch into your brain. And your somatic nervous system is a subdivision of your peripheral nervous system that stretches through nearly every part of your body. So the nerves in the system deliver information from your senses to your brain. And that is a very important thing because they carry commands from your brain to your muscles that can also that you can move around. So your somatic nervous system involves things you can consciously sense and do. And your autonomic nervous systems works without you thinking about it, running behind the scenes processes that keep you alive. Both of these are subdivisions of peripheral nervous system and a subsystem of your overall nervous system. So here's where this fits in. Sensory input. All but one of your senses travel through your somatic nervous system to reach your brain. Sight is the exception because your retina and your optic nerve connect directly to your brain. Your senses in your head, sound, smell, taste, and touch, all use your somatic nerve system. So the sense of touch below your neck uses your somatic nerve system to react to your spinal cord, which then relays signals to your brain. Movement control. Your body's muscles rely on signals that give them instructions to help you move around. The signals from your brain pass through your somatic nervous system to reach those muscles to make them move. Why are we going into all this? It is very, very important to understand that we have a nervous system that is always sensing the world around it. It is always trying to observe how we're taking life in, both internally, externally. But we're not always aware of what our brain is doing. And it's very important to understand how our brain is receiving signals from the world. For most of your internal organs, your somatic nervous system only helps indicate organ pain. That's called a referral. And this is when you feel pain in a specific area, but the pain is actually coming from a problem nearby. One of the best known examples of that pain is a heart attack that you feel in your left arm, your back, or your jaw, or your abdomen. So one of the theories about why that happens has to do with your nervous system's layout. Another example of the somatic nervous system affects internal organs is controlling your breathing. Under most circumstances, you breathe automatically without thinking about it, but you can also breathe manually, deliberately controlling when you inhale and exhale. So, what I'm trying to say is, let's say with a heart attack, suddenly your right arm starts hurting or your abdomen starts to hurt. If you associate that immediately that I'm having a heart attack, you're going to exacerbate the symptoms. If you could take that as maybe I better go to the hospital, maybe I better find out what's going on, that's probably a smart move. Maybe I better get an EKG. Maybe I get one of those cardia mobile things so I can figure out if I'm having a heart attack or not. That would be great because it's attached to your phone. Maybe you can get a watch that does that. But the thing is, there are as many ways that you can manage somatic symptoms. You have to understand that there are measurements in your phone medically that you can do at home to your blood pressure. There's so many ways that you can start to come to grips with why am I feeling what I'm feeling. We need to do a little bit of research on our own. We need to understand our body on our own, but we need to also understand that we don't always have to go to the worst possible outcome. You know, farther down from your somatic nervous system is in all 31 spinal nerves. And the spinal nerves branch out further and become nerves that spread out through your body. So some of these are sensory and they conduct information up to your brain. The others are motor. So, it's very important to understand that your nervous system is set to give you signals. And you need to understand where these signals are coming from and why they're happening. But you don't have to catastrophize. You need to understand, because if you can understand that my body has sent me this signal before, where did it come from? Maybe you can begin to self hypothesize and understand and pacify your brain into having a little bit of faith that this is not what's going to kill you. It's really important to know that somatic symptom disorder is diagnosed when a person has a significant focus on physical symptoms like pain, weakness, shortness of breath. A level of results in major distress or problems in functioning is the biggest factor of how you're taking. How are you taking that sensory perception in? Is it stopping you? Is it pervasive? If it is, you probably want to go to the doctor. But the other thing you might want to do if the doctor can't figure out what's going on, it's a good idea to go to a mental health specialist to try to figure out what is your level of depression and anxiety. Excessive thoughts, feelings, behaviors relating to physical symptoms exacerbate physical symptoms. They may or may not be associated with a medical condition. But let's say, for instance, if you want to exacerbate a mild heart attack, the best way to exacerbate a mild heart attack is to increase your blood pressure and go into I am going to die right now. Or you could go, I'm having a mild heart attack. I better get to the doctor or better get to the hospital right away. Call 911. Okay, that would be the better reaction. But then the people that sit there in fear, I'm going to die, I'm going to die, it's going to kill me. Okay, you're going to increase your blood pressure. That means the heart's got to work even harder, and it's already going through a heart attack. So, the best thing to understand is calming down is going to alleviate blood pressure, which exacerbate the blood pressure is going to exacerbate any kind of pain. If you're going to increase your heartbeat because you're going through anxiety, you are making your body work harder when it's already not feeling well. So it's a very important thing to take down your pain by taking down your blood pressure, by learning to calm down and not go to the worst possible outcomes. One or more physical symptoms that are distressing cause a disruption. Excessive thoughts is where the problem is with somatic disorders. Feelings, behaviors related to physical symptoms, health concerns. Oh, my dad died of this. Oh, I'm probably having one of those. I'm probably doing this. If you're going to go through all these hypotheses and you're going to go to the worst possible outcome, you may as well go to the hospital right now. Ongoing thoughts that are out of proportion with the seriousness of the symptoms is the biggest issue. Ongoing high level of anxiety about health and symptoms is a big issue. If you're limping one day because your ankle is sore and you're assuming that you've pulled a muscle or you've done something really bad to your ankle, instead of just getting through the day, lightening up on how you walk on your ankle and letting your ankle heal, it might do it by yourself and then you don't have to go to the hospital. But people that are hypochondriacs, they got to go to the hospital on every single problem they ever have. Excessive time and energy spent on the symptoms like Googling and AI, trying to figure out their symptoms, all of that stuff actually exacerbates the problems. What you want to do is try to find an answer and then go to what the possibilities are. What are the statistics that this is exactly the worst possible thing that's going to happen to me? This is a very important part of dealing with life. We have to know that, yes, many times we should go to the hospital when we're feeling sick. Yes, many times when things are pervasive, we need to go to a doctor. But the bottom line is we also need to understand that having an alarm every single time you experience some kind of something that is unfamiliar is not a reason to go to the doctor. You can take care of a lot of issues on your own, and you can certainly come to grips with your mental health. That's our show. I want to thank everybody for listening. I love hearing from you. You can do that on our webpage, voiceamericamedia.com or libsyn.com, Dr. Gary Bell's Absurd Psychology. Now remember, pain has a funny way of organizing your mind. Also, dealing with chronic pain is hard, but to deal with people who do not care and understand is even harder. And the only antidote to mental suffering